We are all swinging on the trapeze of life, okay? And below us is a safety net. And because we all get paid, or most of us get paid, as we swing on the trapeze of life, a few of the pennies that we earn go towards making sure that the safety net both exists and is in good working order. Now, some people hate the safety net. Some people have lived lives of such untrammeled privilege and insulation from the reality that the rest of us understand that they don't think they need one and they don't think they're ever going to land in it. And in fact, some people are rich enough to have their own safety net. So they are up on the highest trapeze, bringing in the largest amounts of money. And they've got bespoke, but they've got bungee ropes tied around their waists called bank accounts. And even if they fall, they are going to be fine. They will never land in the safety net that is right at the bottom of the trapezes. The one right at the bottom catches people who would otherwise fall into oblivion. Now, it could be that you've lost your job. It could be that you're poorly. It could be that you're, well, those are the most obvious examples of it, that you're temporarily incapacitated. There are a million reasons why you might end up in that safety net. But if you've got a functioning cerebral cortex, you would want it to be adequate. You would want it to be up to the job. You would like the safety net to be made of something other than the cheapest possible materials. If we were looking at what you might get fed in a safety net, you wouldn't want it to be gruel and boiled turnips. Do you see what I mean? So it's absolutely essential that you understand people who have their own safety nets. People like Rishi Sunak, who, especially since his marriage, if not before, absolutely knows that whatever catastrophes befall him and his, he will never have to bounce around in the same safety net as plebs like us. If the wheels come off our lives, we only have the welfare state to fall back on. There will be various degrees of delay, but ultimately, if the wheels come off and you haven't got inherited wealth or epic amounts of money, enough to pay for healthcare, enough to pay all of your bills, enough to sustain the quality of life that you enjoy now, even if your income ends tomorrow, then you will never have to bounce about in the safety net that catches the rest of us. Rishi Sunak is way, way, way up there, swinging around, and today taking aim at everybody who's already in the safety net. Think about that for a minute. Think about that analogy. I know I get a bit carried away with my analogies, but that is why you have a vague sense of disgust at what you heard Rishi Sunak say in that news bulletin. It's why he is perhaps the least qualified person in the country, never mind in politics, to take aim at people currently signed off sick. Because he's talking about a safety net he knows he will never need, which means that a moral integrity would involve pausing before taking aim at it. But the Daily Mail will love it. The Daily Mail will love it. The Daily Telegraph will probably love it. And all of the people that told you Boris Johnson was a stand-up guy and Brexit was a brilliant idea and the bankers weren't responsible for the international economic crisis of 2008. It was all the fault of refugees and I can't even remember, unemployed people. They will all love it. Kind of run out a road on blaming foreigners for everything, not least because the ones we need to come here and work are still not coming here to work, even though the numbers continue to rocket. You can't really blame it on gay people or homeless people. Why is my life a little bit rubbish? I know why. It's that fella over there who I've never met, but who the Daily Mail tell me is claiming all sorts of sickness benefits while being perfectly fit to work. Now stop for a minute and imagine. It was you, right? You were perfectly capable of going to work, but you wanted not to, so you went to the doctor and asked them to sign you off. You'd be dead of boredom in a month. The massive, massive majority of us would be dead of boredom in a month. Okay, you've got a mate who knows someone who used to go out with a girl whose dad has been signing on since 1973 and spends his whole life like Stan Ogden in Coronation Street, watching the racing on the telly and drinking Tennant Super. Okay, he is not a reason to rip up the safety net. He is not a reason to start dropping hand grenades from the trapeze that we're swinging on, and I don't know that is the plural, as someone has just texted me to suggest, and blow up the whole system or start attacking the people who are currently in need of that safety net. Just because there's a fella over there in a string vest smoking a roll-up who hasn't done a proper day's work since 1973 does not mean that you take aim, as Rishi Sunak is doing today, at everybody pretty much who is currently off sick.
I worked for a program called the Work. There's always been a work and health program,
yes,
in some form of another, but from the government. So the work and health program, it was a 2-year contract. So basically, it was voluntary, but we would have people referred to us from various job centres.
Yes,
and in fact, it was basically recruitment with no commission, if I can put it like that.
Yeah.
And so you have a caseload of people. We're not trained properly. They don't tell you the types of people or anything about the job until you come on. It's an absolute joke. It was an American company subcontracted from another
by the
company.
DWP, so a big private sector company that is
huge. So the whole thing is just, in my mind, a big money making thing.
So you're on the payroll, but you're not really clear about what it is you're supposed to be doing, and all the people that have employed you care about is that the stream of people ensures that the stream of money continues.
Correct.
Right.
It's a disgrace. And then they treat the staff, well, I can't even go into it, this American company quite well.
Well, tell me about the clients before you tell me about the terms and conditions of employment. What sort of people were coming through your doors?
The expectation was that you had to get 4 people a job a month.
Right.
Right. Now, the sort of people coming through were maybe middle-aged. I mean, really people that were really genuinely, and I swear on my life,
go on,
not ready to go to work.
Yeah.
The whole point of the program was to help them through a journey to get them to work. And with some people, it's never going to happen.
Yeah.
It's just terribly, terribly sad. And you have to be a really resilient person. I don't know anyone I worked with. I don't know how I managed to do it for 3 years, because the way that we're treated by the upper management was terrible. And people genuinely cared. I worked with people who really, really did care about what they were doing.
But they were banging their head against a brick wall most of the time, because the people that they were supposed to be getting into jobs were signed off sick for a reason and were not ready.
Yep.
Well, what about,
Yep.
I mean, if I was to be the devil's advocate, I would say, wasn't it your job to make them ready?
Yeah, that was the job. Yeah, absolutely. I mean, there were lots of, I'm trying to think of the word, help me out here, James.
I don't know what's going on in your head.
Lots of places to go
Okay.
for various things with help.
Yes.
And they are out there, but this is in Surrey,
Yeah.
where everybody thinks that Surrey is, ravingly
Posh and rich. Yes.
And there's a huge population of people that are in poverty in this county. Provisions, that's what I was looking for.
Provisions for healthcare.
Provisions, we signpost people to places,
Right.
X, Y, Z. And I was one of these people who's outspoken, and they tried to get rid of me as well. There's another thing. I had more disciplinaries.
So they're just taking the system that you're describing and trying to give it even more to do, make it an even bigger part of the process, trying to get it to mop up even more of what is currently being done by GPs. And the only doctor we've spoken to was, if anything, Nicky, even angrier than you about these proposals. I'm conscious of asking who likes it, but I kind of know that you won't know what you're talking about if you do like it. I know what the Daily Mail will say about this. I know what the usual suspects will say about this. It will all be prefaced by, oh, no, I don't mean you. There are definitely some people who are in real need. But there's loads that aren't. And we should stone them. But how do you know? Who knows? The only people that could tell you probably are the doctors, who could begin to explain to you how big a problem it is. People who could be working but are choosing instead to be signed off sick. 0345 6060 973 is the number you need. You've heard the story. You've heard the Prime Minister. You've seen the targeting of people signed off sick. That is the constituency of people that Rishi Sunak is blaming today for economic slowness and targeting today for treatment, for harsh treatment or life-changing treatment. What is it? Claire's in Crewe. Claire, what would you like to say?
Hi, James.
Hello.
We actually get 2 lots of PIP in this house. I get it myself because I've got severe Crohn's disease.
Right.
And there is no job that I could do that involves just living in a bathroom. My son is 17. He's autistic.
Right.
And he would love a job. He's begging us for a job.
Oh.
But there just isn't one out there. So I 50% agree that, I'd hate to say this, that I'm agreeing with him.
Yeah.
I'm not even going to say his name. I agree that there needs to be some kind of help for people like my son.
Yes.
But you can't just write everybody off, and you can't say that people with mental health and anxiety should just sort themselves out and get a job.
But I mean, where would the help come from? It has to be employer-driven, I would have thought. It has to be a quest, a mission to make employers understand that somebody like your son could be a great asset to their company, but that the way things are set up at the moment, it's never going to happen.
No, because employers would actually be paid for taking my son on. They get like there's a...
Well, that already exists, does it?
Yeah, it already exists.
But there's no job that suits him that you can find.
There's just nobody will take him on with that kind of problem. So there's people like myself that can't work and will. I'm a nurse, and I haven't worked for 20 years. I'd love to work, but there's nothing I could do.
I work as a medical registrar in a hospital in the Scottish Borders.
Yeah.
So, it's quite a stressful job. But the point I wanted to make was that people who get signed off work with stress, often that is their last negotiating tactic when their employers are not listening to them or not wanting to negotiate with them. Whereas in the past, people would have been able to join a union or they would have been able to negotiate to work part-time. Those protections for workers have been eroded over many decades. And now what we're seeing is that people, when they have those problems at work, getting signed off with stress is really the only way that they can give themselves a bit of breathing space. And that's something that I don't think we're recognising in this debate.
Well, I mean, only because you hadn't got on yet, Zack. We're recognising it now. So some of the other safety nets have been removed by legislation. I think I can confidently say by unions, by Tories. Right-wing media launching sustained attacks on unions continue to do so. So the support that you might expect to find in the workplace when you are temporarily unable to fulfil your duties full-time has gone, leaving you with little choice and something about the balance of power in employers. Joe's not being in this category. Joe's employer being quite a good example of how employers can operate, but we've all worked for people who pride themselves on being unpleasant, and they won't say, oh, well, why don't you just go part-time for a couple of weeks, or perhaps we could have a talk about your hours, or perhaps we could help you deal with it, or we could take you out of that situation that you're finding difficult and redeploy you. You'll come up against various brick walls in terms of personnel management, and then lo and behold, things get so bad, you go to the doctor and the doctor says, I'm going to have to sign you off. Sick, because you can't go back to work in this state.
Absolutely. And, so it's really a political act, this, trying to get signed off. And what makes me really angry about what Rishi Sunak's doing is that he's taking that decision out of the hands of a GP who knows the patient, is incentivised to help the patient, and he's going to give it to healthcare professionals who work in the Department for Work and Pensions and who are not going to be incentivised to put the worker at the heart of the decisions that they're making. This is about taking away that negotiating tactic from employees so that they have to put up with whatever their employer's offering.
Just pause there. Just pause there. Yeah. Forget about the bit about negotiating tactics. Just repeat, and I want everybody to listen to this very, very carefully. Just repeat the bit that you just said about what happens when you take away this decision-making process from doctors and give it instead to civil servants whose job really is to reduce expenditure.
Yeah, so your GP is an independent contractor with the government. They're only incentivised to help you, the patient, and their population. It would be entirely different if you're taking that decision out of the hands of your GP and putting it into the hands of a healthcare professional that's employed by the Department of Work and Pensions. That's what this is really about. And, you know, it makes me very angry, actually, thinking about what's going to be happening to people.